What is a stent and when it needs? A stent in cardiology is a tubular support placed temporarily inside a blood vessel, canal, or duct to aid healing or relieve an obstruction, and most of the time it is used to widen the blood-carrying artery so that an obstruction further cannot choke the blood-carrying vessel to the heart. It can be understood as an impression or cast of a part or body cavity, used to maintain pressure so as to promote healing, especially of a skin graft. Basically, a stent is a tiny tube that your doctor can insert into a blocked passageway to keep it open. The stent restores the flow of blood or other fluids, depending on where it's placed. Stents are made of either metal or plastic. Stent grafts are larger stents used for larger arteries. They may also be made of a specialized fabric. Stents coated with medication can help keep a blocked artery from closing. Why do you need a stent? Stents are normally a compulsion when plaque blocks a blood vessel. Plaque is made of cholesterol and other fatty substances that link to the walls of a vessel. You may need a stent during a cardiac emergency procedure to keep your heart pump or function when it's been damaged or choked by obstruction. An emergency procedure is meant to be from a myocardial infarction episode and is more common if an artery of the heart called a coronary artery is blocked. Your doctor will first place a catheter, which is a lens in a hollow tube or so, to examine the blockage into the coronary artery. This will allow them to do a balloon angioplasty to open the blockage. They'll then place a stent in the artery to keep the vessel open. How is a stent performed? There are several ways to insert a stent. Your doctor usually inserts a stent using a minimally invasive procedure. Your doctor will make a small incision and use a catheter to train specialized tools through your blood vessels to reach the area that needs a stent. This incision is usually in the groin or arm. One of those tools may have a camera on the end to help your doctor see the positioning of the stent. During the procedure, your doctor may also use an imaging technique called an angiogram or angiography to help guide the stent through the vessel. Using the necessary tools, your doctor will locate the broken or blocked vessel and apply the stent. They'll then remove the instruments from your body and stitch the incision. What happens after a stent insertion? You may feel a bit of soreness at the incision site. Mild painkillers can treat this. Your doctor will probably prescribe anticoagulant medication to prevent clotting. Your doctor will typically want you to remain in the hospital overnight. This helps ensure there are no complications. You might need to stay even longer if you needed the stent because of a coronary event, such as heart attack or stroke. In such a case, your doctor will use a temporary pacemaker that helps in maintaining your heart rate and heartbeat. When you return home, you should drink plenty of fluids and avoid physical activity for some time.